Is China hiding a new pandemic? Is a new virus surge in China threatening the world once again? India has now detected the first two cases of HMPV or human metapneumovirus, a new virus that is surging all over northern China. So, can this HMPV virus from China sweep the world just like COVID or the Wuhan virus 4 years ago?
Chinese CDC data shows more people are testing positive for HMPV infections.
The Indian government has now demanded the World Health Organization or the WHO to provide timely updates on new virus outbreaks in China. Given the CCP leadership's history of hiding the COVID health emergency before it spread from China to Europe, Americas, and into India. 4 years ago, CCP cracked down on whistleblowers and doctors who exposed the first few cases of COVID but were caught and jailed by the CCP authorities. What has caused the alarm now are social media posts from China showing overcrowded and overburdened health centers with a sudden surge of flu or COVID-like symptoms witnessed among children under the age of 14. The Modi government in India is unwilling to take any such risk again. The Indian Health Ministry has asked the World Health Organization and its chief Tedros to wake up, saying, quote, "The government is keeping a watch over the situation through all available channels and the WHO has also been requested to share timely updates regarding the situation in China," unquote. Adding that India is well prepared to manage any potential rise in respiratory illnesses.
China's outbreak is, they are saying, is a new variant of HMPV. So that is what they are saying.
Eager to prevent another virus spread from China, the Indian Health Ministry also held a key meeting with Joint Monitoring Group under the chairmanship of the DG of Health Services on the 4th of January in, quote, view of the rising cases of respiratory illnesses in China over the past few weeks, unquote. The meeting in New Delhi saw the participation of experts from the World Health Organization, the National Disaster Management Cell, Integrated Disease Surveillance Program, National Center for Disease Control, Indian Council of Medical Research, and leading hospitals, including AIIMS. The two new HMPV cases detected in India are also infants in Karnataka who were detected under routine screening with no history of international travel. The Health Ministry also added that the HMPV virus is already in circulation globally, including India. However, for now, there is no surge of acute respiratory illnesses or influenza-like illnesses in the country. The officials also agree that the increase in number of human metapneumovirus cases is consistent with seasonal flu patterns. But after the key meeting, they have sent out a stern warning for Indians to remain vigilant and prepare for any hurricane. While on one hand, the ministry noted that present surge in influenza virus and HMPV pertain to usual seasonal pathogens that are already circulating, on the other, ICMR or the Indian Council of Medical Research has been instructed by the Health Ministry to rack up the number of laboratories testing for HMPV, which has resulted in the sudden spike in cases in China. So the Modi government has acknowledged the rise in cases in China, but is also playing down fears of a new pandemic. The National Center for Disease Control is also in touch with international agencies to track this situation globally. Dr. Atul Goyal, the DG of Health Services or DGHS India, added, quote, request the public to take general precautions, which also means those who have cough and cold should prevent coming in contact with other people to prevent the spread and take normal medicines prescribed for cold and fever, unquote. Which means follow social distancing. God, that's a term I thought we had forgotten. Remember, the World Health Organization and the US Centers for Disease Control and Prevention have not raised any red flags so far. Even as social media is awash with reports of an HMPV outbreak in China, the World Health Organization has yet to declare any emergency. But then again, the WHO had failed to act during the COVID outbreak in Wuhan as well. China, on the other hand, continues to downplay the spread of this disease. CCP Foreign Ministry spokesperson Mao Ning explained, quote, Respiratory infections tend to peak during the winter season. I can assure you that the Chinese government cares about the health of the Chinese citizens and foreigners coming into China. It is safe to travel in China, unquote. However, social media posts present a completely different picture of overcrowded hospitals and clinics with patients wearing masks queued up in waiting areas. Multiple media channels from around the world have reported on this virus surge in northern regions of China, which causes flu and COVID-like symptoms. Reports claim the surge is already putting a strain on the Chinese healthcare system. What's shocking is that there is no vaccine for the HMPV, and precaution is the only solution. However, the virus is not as lethal as COVID. Similar to India, the Malaysian government also has raised awareness regarding the flu and HMPV outbreak and urged the public to remain vigilant. Shockingly, the Malaysian Health Ministry reported on the 4th of January 327 cases of human metapneumovirus or HMPV infections in 2024, which is a 45% rise from 225 cases in 2023. It is unclear whether the surge in Malaysia is linked to the virus surge in China. Kuala Lumpur added it will continue to monitor, quote, the development of respiratory tract infections domestically and abroad, increase preparedness and take appropriate action, unquote. Meanwhile, HMPV cases are now being reported in Hong Kong as well. This just goes to show how the respiratory illness has sparked extreme concern globally due to Beijing's questionable pandemic response with the Wuhan virus in 2020. CCP's reported attempts to hide the initial outbreak as well as distort key scientific data on COVID-19 pandemic and its crackdown on whistleblowers questioning the government's response to the initial outbreak has caused concern. CCP continues to defend its data sharing on COVID-19 pandemic and asserts that it shared information on coronavirus without holding anything back. However, at the same time, CCP did not allow free and fair investigation on COVID origins by an international team of experts before it spread from Wuhan and caused 7 million deaths around the world. Beijing has been accused of huge cover-up in 2020 when doctors and journalists who warned people worldwide about early infections in Wuhan were either officially confirmed dead, they went missing, or were jailed by CCP authorities. A reported 5,100 number of Chinese citizens were arrested in the first few weeks of COVID outbreak for sharing the truth about the deadly disease, and numerous whistleblowers were labeled as sick so the CCP authorities could detain them or place them in medical quarantine centers. The Chinese government till date continues to remain silent over the fate of some of those whistleblowers who were branded as enemies and are now believed to be in secret detention centers, a sinister form of extrajudicial imprisonment described by officials as residential surveillance at a designated location. Now, what's worse is that there have been accusations of COVID-19 being a bioweapon. In fact, a researcher from the Wuhan Institute of Virology, Chao Shan, admitted to International Press Association in an interview in 2023 that coronavirus was engineered as a bioweapon, but that it leaked from the lab. While the allegations have not been proven, the Wuhan Institute of Virology is known to have been secretly experimenting with bat viruses. However, all indications are that the current HMPV virus surge in China is not as severe or as fatal as the Wuhan virus. Governments in India and Southeast Asia have played down fears of a new pandemic but have urged citizens to remain extremely vigilant and take all health precautions possible. So please wear a mask, wash your hands, maintain social distancing and stay healthy. But the big question remains, can we trust the CCP to present a clear picture to the world? Leave a comment with your opinion, hit the like button and subscribe to Inconnect News.